Hi, this is Dr. Southern at Alturas Medical Weight Loss. I'm here to show you how to do your injection. I'm really excited for your first injection and I want to make sure you do it right. And so I'm going to go through what you'll receive from the pharmacy and how to do that. So you will get a little cooler that arrives to your door, and inside you'll have a little description of about the temperature. So if your package arrives warm, that's okay. It's completely stable. If it's a little bit warm to the touch, just leave it out on the counter until it turns room temperature. Then you can pop it in the fridge. We don't want it to go from really warm from outside straight to the refrigerator because that's where you'll lose potency. It's also very stable for 60 days at room temperature. So don't be alarmed if it comes warm, but if you have any questions, go ahead and reach out to us directly and we can definitely figure things out for you. Okay, then you'll get some ice packs, and then you'll actually get the medication in a little bag. And we'll go through next how to administer the medication.
So in your bag, you're gonna find a few things. One is the bag of syringes. And then you'll also find a stack of alcohol pads. And then lastly, you'll find the actual vial medication, and it will have a little blue cap on it. And you can just pull the cap right off. And then just be sure that you check your actual prescription where you can find the exact instructions on how much to inject. So this one says inject 50 units subcutaneously, once weekly. So make sure you wash your hands before you start this process. But you'll take one alcohol swab and tear it open. You'll find a little square. Now you're going to clean the top of the vial very thoroughly, like in a circular motion, and then keep this because we're going to use it for your skin. Now you can take one of your syringes. You'll notice that it has 10 to 100 units. Sometimes the syringes vary, sometimes they only go to 50 units, but regardless, this is how many units you're going to find on the side of the syringe. So we're going to inject 50 units today. Be careful because sometimes you might have a prescription for 85 units or 83, and so you're going to have to go in between the 80 and 90, and they even have little dashes for each unit. So the first thing you're going to do for the syringe is pull off the back to expose the plunger, and the last part of this is the yellow or orange cap that exposes the needle. You're going to gently pop the needle through the rubber stopper and then hold it up vertically. And then you're going to start pulling back on the plunger down here to pull into the medication. You can see it start to fill up. There's a little bubble at the top, but if you push gently back in, it kind of goes away. Keep pulling down. We're going to go all the way to the 50. That is where the top of this black rubber thing is. There's two pieces, but you're going to stop at where the second one, the top one is. You're going to line it up with the 50. And then if there's a little bubble, you can sometimes just kind of flick it out like that, or push the plunger back in to push the bubbles up. So this one is good, no bubbles, and then you just pop it out. You're gonna wanna inject somewhere around the belly button. It doesn't really matter where, and you can alternate sides, but the main area that we inject is right here in the abdomen. So now that you have your medication drawn up, you're gonna take the alcohol swab that you held onto, and you're gonna clean the area that you're gonna inject with your skin. And then you'll take it in your dominant hand and kind of grab the skin around where you're going to inject it, and then just go straight through the skin. And then just push on the plunger and it'll all go straight in. And then when you're done, you just take it right out. Usually no blood or bandages necessary, and this you can throw away in an empty water bottle.